I could go on for a long time, but I think I'll stop and I'll take questions because there are usually lots of questions. Yes?
When you're looking for the treatment, I never hear you mention any dietary changes or lifestyle changes. And I'm always curious about why dietary changes, dietary habits aren't explored to see if there might be some changes that might exacerbate this.
They are, and now we're looking into the Feingold diet again, which was never replicated. Feingold diet in the 70s, food additives, sugar. I've had a lot of people very interested in that, and they will follow very strict regimens. I've rarely seen major differences. Children may be different, but in the adult population, I haven't seen major differences. There is one psychiatrist who has a book called Healing ADD, Dan Amen, and he has sort of says there are 6 types of ADD, and he recommends particular nutritional approaches. We talk to our patients about eating a balanced diet, things of that nature. We talk about a lot of nutritional things. I mean, there are things that are done, but there's not been a huge body of research showing that those approaches are anywhere nearly as effective for the vast majority of patients as the medications are.
Well, of course you wouldn't know that.
Because
of the pharmaceutical industry.
no, but there are other sources of
That's
information.
fine.
No, there are other sources of information. And I will, for people who are interested, there's a list of herbal products that we will recommend. And I've had people come back and find that there were benefits to those things. I've also had them complain that they were too expensive. There's a complicated regimen of blue-green algae, and it costs $200-300 a month. It's a lot, the other thing is people want a quicker fix, and the medications do work quickly and they do work well. There are other treatments as well. I mean, there are cognitive behavior therapy, there are other behavioral modification approaches, there's EEG biofeedback. So there are other things. I mean, it's not just the medication. Counseling for most people, family therapy.
If it's known that it's an inefficient amount of dopamine, are they doing any studies of what could be used to cause more dopamine to be in the front part of the brain?
Well, and that presumably is the site of location where the stimulants work. Stimulants elevate the level of the neurotransmitters. It's interesting, however, that the standard Parkinson's disease medications that work on dopamine, other than a few little studies that's found benefits, the standard Parkinson's medicines don't work for ADD. So it's not just, hey, you don't have enough dopamine, so why don't you take amino acids that lead to dopamine production and the problem will be solved. It doesn't work.
I got two questions. One is, what is the rate in the general population? And the other is, could you talk a little bit about people self-medicating?
Okay. Depending on the studies, the surveys, probably in the area of 4 to 10%. More common in males than females, but not nearly as much as what we used to read years ago where they would talk about it being 10 to 1. Girls with ADHD are less likely to be hyperactive than boys. And since the hyperactivity is so obvious, that's what gets the attention in the diagnosis. My practice, it's probably 50-50 men and women. But that's complicated because men are less likely to seek treatment for anything that sounds like mental health. So there's a male predominance. Self-medication, the rate of substance abuse in unmedicated adults with ADHD is roughly double the population at large. And marijuana, can't tell you how often I hear it's the only thing that quiets the brain down. Unfortunately, it interferes with stimulus processing and attention mechanisms, so double-edged sword. A lot of people have tried cocaine, and they'll say things like, wow, when I tried cocaine, my friends were all jumping around, and I sat down and read a book. It made me nice and quiet. Alcohol, there's certainly a higher rate of alcoholism. Cigarette smoking, extremely common in ADHD. And back before cigarettes were as untolerated as they are now, children who started smoking before age 16, a very high rate of them have ADHD, and they would learn that if they smoked a cigarette between classes, it would give them about 40 minutes to focus, because nicotine elevates levels of dopamine in the brain. And they are looking into nicotine patches. Yes?
Why, if it's a stimulant, does it calm them and make them
I'm
zombie-like?
glad you asked. 'Cause here's my analogy. You're at the Providence Place Mall, and the guards are napping. And the teenagers start running around and causing all sorts of trouble. The guard wakes up, drinks some coffee, gets going, starts patrolling. The children and the teenagers quiet down. The teenagers are the ADHD symptoms. The guard is the frontal lobe. You're hyperactive because the motor control parts of the brain are not being controlled. The medication improves the level of control, so now the hyperactivity and the other symptoms are reduced.
But even to the point of making a kid zombie-like?
It can be occasionally in adults, although adults, if they get too much of a stimulant, they react the way you would expect. They get jittery. The other thing is, and this is, I've had patients come from other doctors. The symptom, as you increase the dose of medicine, the symptoms reduce. But it's not indefinitely, and there comes a point where the curve goes back up. So if you give somebody too much medication, they will start getting more hyper again. And you can get into a vicious cycle, because the patient will say, well, I'm still hyper, I'm still restless. Oh, you need more medicine. They get a higher dose, and they're still hyper. And then get big problems by over-medicating people. So, yes?
Of the people who come in to see you asking to be tested for ADHD, about what percentage do you diagnose as actually having it? And then also, what about meditation?
I'll answer that. This meditation question is easier to answer. It works wonderfully. Meditation and also exercise are very, very good for the hyperactivity. Some people, however, are so inattentive they can't learn the techniques to meditate, but that works very well. The other question is more complicated, because my practice is so specialized that I think there's a certain amount of screening that's already gone on before people are sent to me. I also started using a computerized test that was developed a few years ago that has about 90% accuracy. So a very high percentage of the people who are coming into our office have ADHD. People go online, they read books, they do the screening test. A lot of our patients have family members. And that'd be the one other big thing. This is one of the most genetic conditions we see. Now, I'm not talking about eye color, hair, single gene things. The only other common complex trait that's more genetic than this is height. ADHD is more genetic than migraine, hypertension, schizophrenia, asthma. So a lot of our adult patients come in after a child, or in some cases a grandchild, is diagnosed. So it's a very high percentage. Every once in a while we'll have people come in who have undiagnosed anxiety. The other thing that can mimic ADHD, sounds surprising, is sleep apnea. People with undiagnosed sleep apnea or other sleep disorders will have daytime cognitive symptoms that can mimic ADD.
thinking in terms of the classroom, for teachers, rather than letting kids be agitated, trying to teach them to still themselves. Is that helpful?
I almost want to shunt it to more of a specialist in the audience. I don't deal with younger children, so I don't know that I can address that directly. Sorry. Did you have? No? Okay.
What about drugs that do not stimulate?
Non-stimulants.
Yes, non-stimulants. There is one, I think.
Actually, now there are 3 approved non-stimulants, and there are a whole bunch of unofficial off-label medicines. They work, but not for as high a percentage of patients. And the results are, on average, not as strong. The first approved non-stimulant for ADHD is called Strattera. I probably have a success rate of maybe half my patients. Do you have better results with Strattera? No. It's interesting. You say, oh, it's a non-stimulant. It's going to be easier to use, safer. Horrible problems with upset stomach, getting people acclimated to it. And when it works, it rarely does as much for the average person as the stimulants do. There are 2 old blood pressure drugs that have recently been released in new long-acting forms. May be effective for pediatrics, but the adult population, I've not had huge success with those medicines. For a lot of people, though, there are off-label medicines, meaning once a drug is marketed and released and it's legal, we can prescribe it for anything. The only thing when you say off-label, that just means that the FDA doesn't allow the manufacturer to market the drug. For many, many years, blood pressure medicines known as beta blockers were used to prevent migraines. It was years before any of those manufacturers did the research so that they could say for migraine prevention, but neurologists were using those medicines for decades. Particular antidepressants, Wellbutrin, can be very effective for ADHD. If someone came to me with significant depression, if they were also overweight and smoking and had ADD, I would put them on Wellbutrin. It's also known as Zyban to stop smoking, and it's one of the few antidepressants that can cause weight loss. Works for about half the people who try it. Before Prozac came along, the main family of antidepressants were the tricyclics, amitriptyline, nortriptyline, drugs like that. For children who had tics, next month's show, and ADHD, and there is a higher rate of those conditions occurring together, you would not usually give stimulants to children with tics, so they would give them the tricyclic antidepressants, and those work for some people. I think most of us who do ADHD would be thrilled if the non-stimulants worked better.
Or at least
Easier
as
for
well.
us.
Or at least as well.
Yeah, well, at least as well. Well, better than they work. Because stimulant medicines, we have to write a prescription every month. There are no refills. We can't call the pharmacy, we can't fax the prescription. Those non-stimulants, you can write a refill and write five refills, and the patient has 6 months worth of medicine. So it would be a lot easier if they worked better, but they just don't. How about this side of the room? Very quiet. No? Okay. Yes.
Are there interactions with other types of medications that people can't take if they're taking them?
There are some interactions, but not a huge number, by the way. The commonest problem is in people who are taking decongestants. The Sudafed or phenylpropanolamine, those are sort of mild stimulants. So if you're going to be on a decongestant, you may have to lower your dose of stimulant. Uncommonly prescribed MAO inhibitors, you would not put people on stimulants with those, but they're not widely used these days. In just a general sense, you don't give stimulants to people with certain structural disease of the heart rhythm problems, uncontrolled high blood pressure, a history of major psychiatric illness. But medications, surprisingly few interactions. Every once in a while, we'll actually have a person who goes on a stimulant with high blood pressure, and their pressure gets lower when they're on the stimulant because they're less frantic, they're less hyper, they're less overwhelmed. And sometimes the internists can't believe it, but the stimulant helps relax them. Yes?
I'm still a little unclear on, it seems like there's so many reasons and different things that can cause someone to be unfocused or impatient or, these things that seem to define or characterize ADHD. Do you care about that, or are you just sort of saying wherever it comes from it's called ADHD, or is it something specific?
Well, if you look at a list of ADD symptoms, I doubt there's anybody in this room who wouldn't look at the long list and say, well, I have some of that once in a while. What makes the diagnosis is that the person with ADHD has many or most of the symptoms in many different situations. And the important part of the diagnosis is that the symptoms are interfering significantly in life. So, sure, a lot of people get impatient waiting on the line at the supermarket or at the bank, but the person with ADHD who just throws the groceries down and walks out, that's a little different. It's a question of degree, pervasiveness of the symptoms, and it's a tough question clinically because a lot of people say, well, I'm a little forgetful. How do I know they really have this and they're not just trying to do too much, not getting enough sleep? You're right, there are a lot of reasons you could be inattentive. You're looking at the history. You really, really have to get symptoms dating back to childhood. Now, this is not something that just cropped up. It's not something that's only present in one small aspect of life. But, that's why we have a tough job, right, Ethan? Yes?
I have two questions. One, does caffeine do anything helpful? Two, are there any long-range studies that you know of, since Ritalin's been around for such a long time, about long-term toxicity? Because I'm assuming people have to be on it for a very long time.
Okay, so first question about caffeine. I have actually diagnosed a few people who developed, supposedly, their symptoms after they started having reflux or gastritis and had to stop drinking coffee. And they came in saying, I think I just developed ADD. I'm thinking of two men, both started drinking large amounts of coffee in high school because they learned that it helped them function. Caffeine is a mild stimulant. One of my questions is, how many cups of coffee do you drink a day? When a person looks at me and says, Doc, you mean how many pots a day? I know those people will do very well with stimulant medicine. The problem is caffeine is absorbed very quickly. And if you were to sip a little bit slowly through the day, it might be worthwhile, but when you drink a lot, suddenly you get this surge, you're going to get some of the side effects, then it drops off. And again, for some people, it can cause stomach problems. But yeah, caffeine can do some of what a stimulant does. There have been observational studies, long-term effects, surprisingly little data showing serious problems with the stimulants. Stimulants are also used to treat things like narcolepsy. And narcolepsy tends to develop in young adults and not go away. So people with narcolepsy have to stay on it a lifetime. Clearly, you have to monitor people to make sure that their blood pressure is under control. But I'm just not aware of really good evidence about these stimulants having a cumulative side effect. Ethan, you have any? No, it's just...
In children, there was a question as to whether it would suppress growth because stimulants tend to diminish appetite. So the thought was, if you give it to a young child who's not eating as well, will he not achieve normal adult stature? And the outcome studies have shown that if there is any suppression of growth compared with kids who've never been on stimulants, it's not very much. But that's looking at all children who are on stimulants versus children who've never been on stimulants. So for an individual child, it's conceivable there might be some child whose growth will not be as much as it would be otherwise, but by and large, it has little, if any, effect on growth.
Yeah, a related question that often comes up is, if you give children stimulants, does that lead to drug abuse in the future? And in fact, there have been studies tracking this, and the opposite is true. When you treat early, you have a lower rate of substance abuse in your teens and early adult years. Yes?
Curious, because it's gotten so much attention over the past, say, 20 years. Do you think it's overdiagnosed? I mean, it's certainly legitimate, but a condition, but...
It's really sort of a community thing. In some communities, it is overdiagnosed. There's no question about it. Although it's very interesting that there was a study a few years ago that looked at all of the children who had been diagnosed, and something like less than half of them were actually on medicine. But yeah, certainly there are going to be communities where the numbers don't seem accurate. Overall, though, if you look at adults, only a small percentage of adults with ADHD have been diagnosed. So I think, again, a lot depends on the community. But it's very tough because, again, I use this quotient computerized test to increase accuracy. But you're talking about a condition that's largely based on getting a history. Somebody has to come in and describe a list of symptoms. Well, if you're really motivated to get the diagnosis, you can learn the list of symptoms. Now, if you come to me and say, Doc, ever since I was a kid, I can't sit still, I have trouble reading because I lose my place over and over again, I'm forgetful, I'm disorganized, I blurt things out. There's no, how do we know? I stopped telling people we're going to have a gene test soon because after 10, 15 years, it's never come. We don't have a single blood test. There's one clinician who does these fancy SPECT scans, a nuclear medicine study, and he says he can see patterns in the brain, but that's not widely available or widely accepted. So it's a tough diagnosis. You really have to ask a lot of questions. You look at the family history, and you have to have a gut feeling for what you're hearing. It's not always easy.
Just to point out, another thing that can be confusing is any average person who takes a stimulant will be able to increase their performance a little bit. It gives you a 2% edge. But the difference between a person who's functioning, say, at 50% of their capacity, who takes a stimulant that brings them up to 98%, versus someone who's functioning at 96% and goes up to 98%. So you can find small differences of improvement, but that it's not needed for the people functioning in the normal range.
And that's actually a big thing. Second, there's something now called cosmetic neurology. And I don't mean Botox. People who don't have a disease asking for the medicine. I'm a little forgetful. Should I take Aricept or one of those other Alzheimer medicines? A lot of academics will try and get on stimulants so they can stay up later, do more writing, do more research. In fact, it's gotten so widespread that the American Academy of Neurology actually went and issued a position paper about what should a neurologist do if you are asked to prescribe a stimulant for somebody who doesn't have ADD. And I was a little surprised. The Academy said you're allowed to do it, but you don't have to. And you have to take special precautions to let people know that there's very little research about the effect of stimulants in people without ADHD. The research, you do studies on patients and see how the medicines work, but people who don't have the condition, very little research. And there are physicians who will do it. And we get phone calls once in a while. Hey, before finals, I could really use some help. I tried my friend's Adderall once, give me a prescription. And we actually don't even do that for people with ADD. Either you're kind of interested in being treated, not just for finals or once in a blue moon. Yes.
So I had a couple of questions. One is about that. Like, I know of tons of people going to college who would be on ADD and then would sell it.
Yeah.
And I witnessed a lot of abuse of ADD and had personal friends who
of the Adderall.
Of Adderall,
Yeah.
sorry, not ADD. And like friends who at a young age were diagnosed and given ADD, but then given Adderall. My bad, I'm messing them up. I have ADD.
Yo, we got ADD for sale. What's good?
So, and then I was interested by what you said about people not being addicted, because I know of people who started abusing the Adderall, and it became a huge problem along with other things. So, and one of the things I felt like was that some of my friends weren't going to therapy as well, which I saw as a huge problem. So I'm wondering, and I saw them just go to the doctor, bang, prescription, get the Adderall, that's it. And I saw that as a huge problem. I don't know how you feel about that.
Well, Adderall is probably the most abused drug on college campuses right now. $5-10 a pill. But again, it's because even if you don't have ADD, there's probably a benefit if you use some stimulant medication. Most people with ADHD, if they take too much of their stimulant, they feel lousy. Years ago, some of the big ADD specialists would say they've never seen a patient abuse the stimulant. It's not true. I've had patients who I know have ADD snort it, overdose, abuse it, party. But most people who have ADHD don't enjoy taking the medicine. They just feel lousy. People without ADD, if you're on small amounts, a little bit at a time, you'll be okay. But if you stay on it steady, you start needing more and more. You stop taking it, you crash. It's highly addictive, and that's why it's so controllable. Another question? No?
Oh,
yes.
There's a lot of things about people with ADD that they negative things, like they crash a lot, they do bad in school, and I'm sorry, I just kept hearing bad things. Is there any good things about it? I'm sorry.
No, listen.
I just
if you
feel
look
bad
at some people, the founder and former CEO of JetBlue has ADD.
Oh, Virgin Island dude.
Okay. I think they say that Edison, the great inventor, had ADHD. Some people with ADHD are extraordinarily creative, imaginative, because there's a fine line between being spontaneous and creative versus impulsive, not crossing over. There are some people who are extraordinarily talented artistically who have ADHD, and they're able to channel that sort of impulsivity into creative ways. But it's very individualized. And in terms of academic success, I have some extraordinarily accomplished academic patients, people who are professors, book writers, poet actually.
And these are people on drugs or on no drugs?
No, on medication. And it's also interesting because a lot of people think that if you're creative, you're not going to be able to do your art when you're on medicine. Most of the artists I've treated found that they do better on medicine. One woman preferred to do her artwork without medicine, but everything else in her life, pay the bills, do the groceries, that's what she medicated. So it's very, very individualized.